Hello again, CT Dental Assisting students. We are now at chapter 33 in your textbooks for those who have. If you do not, please follow on eTuto. The presentation I'll be speaking with or on is on eTuto. We are at learning outcome number 12, if I'm not mistaken, or chapter 12. So that's where we're dealing with fixed prosthodontics as well as gingival retraction. So you may have seen so far that we've covered removable prosthodontics, removable prosthetics, as well as dental implants that integrate a bit of fixed and removable. And then here we'll be dealing strictly with removable. This is another important chapter because as a dental assistant, you'll be required to give patients post-op instructions. You will be involved in all the steps when we're fabricating fixed prosthodontics. So you have to know all the materials involved, the type of materials that we use in which situations, and then from there, then the type of procedures that the dentist could be doing in chair in the dental practice. So this is a bit of an important chapter of your curriculum. Okay, so with fixed prosthodontics, similar to removable prosthodontics, it is the specialty in dentistry that deals with the placement of artificial structures where tissue as well as natural teeth have been lost. The only difference is now this one is actually cemented into the patient's oral cavity. Okay, so that's basically what fixed prosthodontics is. So we are trying to replace any missing or lost teeth as well as surrounding tissues by making use of fixed prosthesis. Okay, so then from there, there are multiple techniques and multiple, how can I call this, procedures that we can use to achieve this final fixed product. Okay, so then we talk about indirect restoration. So indirect restorations basically explains that with fixed prosthodontics, we actually fabricate, we actually cut, if I can say, we cut a tooth, we fabricate a provisional restoration, and then from there the patient gets sent home, and then our impression then gets sent to the lab to actually make or fabricate whatever prosthesis that we are looking for. So normally with fixed prosthodontics, this definitely takes multiple appointments. This is where then CAD/CAM comes in. If you remember last week's lecture, in that if the dentist has CAD/CAM software or equipment in the practice, then you eliminate the need for multiple appointments. But normally multiple appointments are necessary with fixed prosthodontics, and we basically make use of very detailed, very detailed impressions that we actually send to the lab for them to fabricate whatever prosthesis that we are looking for. So it takes multiple appointments. It is usually expensive, and then from there is known as an indirect restoration. Why? Because we prepare the patient's tooth, we put a provisional restoration, we send the impression that we took from the patient's tooth to the lab, making use of a detailed impression, and then we send the patient home with the provisional restoration. When the patient returns and the prosthesis is back from the lab, we remove the provisional restoration, and then we place the final restoration that is known as the cast restoration. Okay, I hope I didn't lose you guys. I went nice and slow. Okay. So what's the purpose of fixed prosthodontics? So we try to restore masticatory function, because obviously if you have edentulous spaces in your mouth, let's say on the left hand side, you're most likely to, the patient, be dependent on your right hand side, which may have TMJ and associated issues. Okay, we will improve aesthetics and often self-esteem, so the patient obviously feels better about themselves. Even the convenience of having something that is permanent in the oral cavity, it improves speech. So unlike with the removable dentures where we have to check for our F and our V and our S sounds, we do not necessarily have such issues with fixed prosthodontics. It promotes good oral hygiene, because obviously now you've put something permanent in your mouth, so it encourages or forces the patient to take good care of themselves, good oral hygiene, practice good oral hygiene at home, so that the prosthesis is not compromised by the lack of oral hygiene. And then from there, it prevents further movement of teeth due to the support of the prosthesis. You remember, if we have edentulous spaces, teeth move either anteriorly inferiorly or superiorly, depending on which teeth have been lost in either one of our arcs. Okay, so the loss of one tooth can actually cause a multitude of tooth movements within the quadrants as well as the arcs that are involved. So this is why basically fixed prosthodontics are important. So the advantages of fixed prosthodontics: one, they are aesthetic because we make use of mainly porcelains as well as acrylics to achieve a nice uniform and complementary shade for the patient. And then from there it assimilates to the natural dentition, so it's very natural for the patient. And then it's secure in the mouth because it is fixed either to a tooth or abutment teeth that help keep it in place and keep it stable and very retentive. So the patient will not be having issues or the annoyance of constantly having to take out the prosthesis at the end of the night, as we do with our removable prosthodontics. And then from there it restores function for many years, especially if it is placed properly and the patient maintains good oral hygiene. The prosthesis can basically sit in the oral cavity for a long time. So we come to the role of the dental assistant in B. Yes. The dental assistant has to provide patient education. So by patient education, we are referring to explaining to the patient the type of prosthesis that are available to them, or the type of even fixed prosthesis that are available to them. The dental assistant has to explain the financial implications, like, hey, this might cost a bit more than your removable prosthesis. The dental assistant is expected to be able to explain to the patient like the procedure, sort of in layman's terms, like, this is what we're going to do in the first visit, this is what we're going to do in the second visit, if necessary, this is what we're going to do in the third visit. So that's the type of information that we expect from the dental assistant. And then from there you are expected to prepare the treatment room. So that would be getting burrs ready, getting impression material ready, getting the correct trays ready, getting the correct x-rays or appropriate x-rays ready for the patient, getting your normal tray setting prepared for your dentist. So those are some of the things. If your dentist has a CAD/CAM machine, it would be actually switching them on, making sure that they are functioning properly. So those are some of the things you will be expected to be doing. And then from there, it was to take pre-operative x-rays. Even as far as taking pictures, like, it doesn't hurt. Take pictures of the patient, take pre-op x-rays, be it a pan, a safe, as well as periapical x-rays. Okay, and then from there, making preliminary impressions and bite registration, so that you will be doing in conjunction with your dentist. But you need to be aware or know the types of materials that we will be using at different instances, like which materials am I going to be using for my preliminary impressions, which ones am I going to be using for my detailed impressions, and so on and so forth, as well as make it taking the bite registration either with polysiloxane or with the wax sheet that we made into our horse ridge shape. And then from there it would be selecting the shade. We normally try to select the shade before we actually prepare the tooth. So before we even start with the procedure, take your or select your shade in conjunction with your dentist, as well as with the patient's input and consent. Okay. From there, you will be expected to assist chairside, providing equipment and material, and then from there, suctioning the patient and ensuring that the patient remains comfortable at all times. And then you will be involved with the placement as well as removal of the temporary crown. I will be explaining how we get to our temporary crown by making use of basically the impressions that we took as our preliminary impressions. So you will be assisting in the placement as well as adjustment and removal of our temporary crown when the patient comes back and the restoration comes back from the lab as well. Then from there, you'll be assisting with the removal of the cement. Keep in mind that temporary restoration, that the patient is going to go home within the meantime while their final product is being fabricated in the lab. We will seat it into the oral cavity using cement. So you will be expected to know the type of cement. You'll be expected to mix the cement, place it in the provisional restoration, and give it to your dentist. You will be expected to pour impressions, especially if, like, with your preliminary as well as with the final detailed impression that we will be taking. And then from there, it is the fabrication of custom trays that ensure that we get an accurate description of the patient's oral cavity and its associated structures. Okay. Yeah. Okay, when it comes to patient considerations, we're talking about the complete medical as well as dental history. So it is very important that you as an assistant take a very thorough medical as well as dental history of the patient, because we want to make sure that the patient is not only healthy, but that we will be placing this prosthesis in a healthy mouth. Okay, and then there's the examination of intraoral as well as extraoral tissues. So with intraoral tissues, we are talking about the teeth, as well as in particularly the abutment teeth, especially if we're going to be like placing things such as bridges. We make sure that the teeth are not periodontally compromised. We check the quality and quantity of the underlying alveolar bone. We check for rampant caries, things of that nature. And then extraorally, of course, patient's musculature, facial aesthetics and profile, so that we make sure that whatever that we are placing is in line with whatever is naturally occurring when it comes to the patient. Then with our radiographs, there's a multitude of radiographs that we can be taking. This includes then periapicals, cephalograms, even CBCTs if the technology is there. So we make sure that we take them pre-operatively as well as post-operatively. Then from there is the impressions for study models. So we will be taking alternate impressions for those study models, as well as functioning as diagnostic costs for the lab, so that they can check occlusion and ensure that the prosthesis is in line with whatever's naturally occurring in the patient's dentition. And then from there, intraoral photographs taken with an intraoral camera if the facilities are there, as well as extraoral photographs of the patient's profile view, a frontal view, profile view, as well as the laterals if deemed to be necessary. So those are some of the patient considerations. And then candidates for fixed prosthesis, the patient must have motivation to maintain the prosthesis. So we also need to check that, one, are they highly motivated, and is the oral cavity suitable enough that we believe that this prosthesis can stay in the oral cavity for a prolonged period of time. And then obviously the patient must have healthy supportive tissues to ensure the survival of our prosthesis. Then, okay, case presentation. So we provide treatment choices to the patient. So we will be discussing things such as crowns, veneers, cost restorations, the types of materials that are available at our disposal, as well as maybe some dentures, depending on how many teeth we have to restore. Then from there, we're going to review costs as well as insurance coverage. Medical aid, sometimes they either pay fully depending on the option level that the patient is on. Obviously, the cheaper the medical aid, the less likely it is that they will be covering for fixed prosthodontics, because they normally just cover basic treatments, especially with the lower option levels. With the higher ones or the intermediate ones, they can just be like, we can pay, like we can do a partial payment or a co-payment, then the patient has to fork out the rest of the money. And then a high level medical schema option, then the patient will not be paying at all, then the insurance will be covering the procedure 100%. So these are the things that we have to discuss with the patient, find out from the medical aid as well, provide the patient with the information so that they can make an informed decision. And then from there, you are expected to discuss the number of appointments required. So if you're in a practice with CAD/CAM facilities, you'd probably be able to prepare the tooth and actually deliver the prosthesis in the same appointment. It might just take longer than a typical appointment, whereas in other cases, in most practices that do not have the CAD/CAM facility, then you would tell the patient that it normally requires about 2 appointments. So the first one will be taking all the necessary impressions, preparing the tooth, placing a provisional restoration. Then with the second one, we'll be removing the provisional restoration, and actually placing the final restoration, also known as the cast restoration. So then those are some of the things that you will be expected as a dental assistant to relay to the patient.